Next, we are going to discuss about the secretion of HCl. How this HCl is secreted in the parietal cell. Actually, this is a very potent enzyme and means acid. No, this HCl is a highly potent acid.
Yes, ma'am.
So, when HCl secreted inside the cell may digest itself. The cell
Yes,
may
ma'am, I know.
digest. So,
Hmm.
this HCl secreted as H plus and Cl minus ions. HCl
Okay,
secreted
ma'am.
as H plus and Cl minus ions, and then they flows out to the intracellular canaliculae of this cell. Canaliculae.
Okay.
So the formation takes place in the micro canaliculae.
Okay,
Okay,
ma'am.
of
Okay.
this parietal cell.
Okay.
As H plus and then they combines to form HCl. This H plus and Cl minus ions combines to form HCl,
Yes.
hydrochloric acid. Okay.
Okay, ma'am.
So can you see this diagram?
Mechanism of secretion of HCl.
Yeah.
Water passes. Yeah, it came. Mechanism of secretion of yes, ma'am.
Okay. Okay. So inside the cell,
Yes, ma'am.
there is carbon dioxide. Diffusion of
Okay,
carbon
ma'am.
dioxide takes place. So carbon dioxide diffuse into the cell. This carbon dioxide combines with water inside the cell. Okay.
Okay, okay, ma'am.
Okay. So carbon dioxide diffuses into the cell, and this carbon dioxide combines with the water inside the cell to form carbonic acid. Hmm? With the help of the
Yes, ma'am.
enzyme carbonic anhydrase. At the top,
Yes, ma'am.
you can see the reaction. CO2 plus H2O gives H2CO3. This H2CO3 is the carbonic acid. Okay.
Yes, ma'am. Yes, ma'am.
With the help of the enzyme carbonic anhydrase. So this H2CO3, that is the carbonic acid, is highly unstable.
Yes, ma'am.
So the split into H plus and Cl minus CO3 minus ion. HCO3 minus H plus plus HCO3 minus. H plus ions and the bicarbonate ions. This
Okay, ma'am.
acid split into H plus and
CO3
HCO3
ma'am.
minus. Yeah.
Yes, ma'am.
This HCO3 minus ion diffuse into the extracellular fluid, and from there the chloride ion from the cytoplasm enter into the cell. Okay. This
Okay. One is
HCO3
plasma, one is
minus.
parietal, and so from parietal cell it goes out to the plasma, ma'am.
Yeah. Yeah. The
Okay.
fluid, cellular fluid. No.
Okay.
So HCO3 minus diffuse out of the cell into the extracellular fluid. Okay.
Okay, ma'am.
Then the Cl minus ion enter into the cell in exchange of this HCO3 minus.
So HCO3 goes out and
Cl
Cl minus
minus
enters.
enters.
But how, ma'am? Because of the this thing, that
In exchange
diffusion.
of this. Yeah, diffusion. 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 Okay. Then this Cl minus ion enter into the cell and then to the canaliculae. Okay.
Okay, ma'am.
So when the Cl minus enter into the canaliculae, so the Cl minus reaches the canaliculae. Okay.
Okay, ma'am.
From extracellular fluid, then to the cell, and then to the canaliculae. Okay.
Okay, ma'am.
So they develop a negative potential. Negative
Okay.
ions are transferred. So negative potential is there. So this causes flow of K positive ions. K plus ions. Okay. When Cl minus
Okay.
diffuses into the lumen, then the potassium ions from the lumen enter into the cell, and also small amount of sodium too. Okay, from
Okay.
the lumen to the
Okay, ma'am.
okay.
Okay, ma'am.
Okay, so there is a small mistakes from cell into the lumen to maintain the negativity. So outside the cell, there is develop a negative potential. So the potassium ions, K plus ions, enter into the lumen from the cell. Okay, to maintain the neutrality. Okay. When the Cl Vishnu,
so
when the
one
Cl
is
minus
positive.
no, when the Cl minus ions enter into the lumen,
Uh,
the negative
yes,
charge of the lumen increases. So, in order to maintain this, some positive charged potassium ions also enter into the lumen to maintain the neutrality. Okay. Okay.
ma'am, but my question is, ma'am, when HCO3
Yeah.
goes out, already there's a negative potential in the cell, right, ma'am?
Yeah.
And that
Where
hold when Cl minus enters, right?
in the extracellular fluid, no?
It
HCO3
goes from
minus to the
intracellular to the extracellular.
extracellular.
So in intracellular, there'll be a negative charge, no, ma'am, when HCO3 goes out. Huh?
How negative
Ma'am,
charge?
because it's, ma'am, in complete state, it is in cell integrity is there, no, ma'am. So when
Yeah.
one fluid goes out, diffuses, there'll be a negative charge inside the cell, no, ma'am.
So, but in order to maintain this, water is split. The split down of water also takes place. Okay. Then H plus
Okay.
and OH minus ions are formed inside the cell.
Oh, okay.
Okay.
Okay,
So,
okay, ma'am. Okay, ma'am.
okay. So OH minus ions are there. H plus and the OH minus ions. Okay.
Okay, ma'am.
Okay.
Okay, ma'am.
Okay. Then Cl minus ions and potassium ions are there in the lumen. Okay.
Okay.
Then the H plus ions formed inside the cell. The H plus
Okay, ma'am.
ions from where the H plus ions are formed.
From this H plus ions are formed from this
From
water splitting, no, ma'am.
and also from the
So from
carbonic acid.
H2CO3.
Yeah, H2CO3. So H plus ions are there. No. Some
Yes,
of
ma'am.
the H plus ions combines with the OH minus to form water. Again water. And some of the H plus ions, Vishnu,
Yes, ma'am.
okay, actively secreted into the canaliculae. Some of the H plus ions actively secreted into the canaliculae in exchange of potassium ions. So many potassium ions are there in the lumen. Some of the potassium ions enter into the lumen in exchange of H plus ions by H plus K plus ATPase. Okay. Using ATP. They are using ATP.
Okay, let's check energy.
Okay.
So there's a negative charge inside the cell.
So the H plus ions and
Yes,
Cl
ma'am.
minus ions are in the canaliculae. Okay.
Canalicula means lumen, right, ma'am?
Yeah, that lumen. Yeah.
Yes, ma'am.
Okay.
Yes, ma'am. Yes, ma'am.
So this results in the formation of HCl. The H plus ions and the Cl minus ion combines to form HCl.
Okay.
Then water also enters from the cell to the canaliculae, means the lumen, by osmosis. Water from the cell also enter into the
Canaliculae.
through by osmosis. Yeah. So the final secretion of HCl is formed. Okay.
But how does the Cl minus come out also as Cl minus, ma'am? When they come out from the cell, their sign should change, no, ma'am?
Where?
There's a road, no, ma'am? What is a road, ma'am? From parietal cell to lumen.
That's all diffusion.
Oh, it comes from diffusion. Okay. Okay.
Okay.
Okay.
Okay.
Okay.
See, can you see the screen? Synthesis.
I can see mechanism of secretion of HCl, ma'am. Will come 1 second.
Okay.
You start telling them that by that time will come. Yeah, secretion mechanism of secretion of HCl.
Yeah, the HCl present in the. Can you read the first sentence?
Yes, ma'am. HCl present in the gastric lumen is secreted by parietal cells of the
Yeah.
purpose.
Okay. Okay. So the 3 steps in this occurs in 3 steps. The chloride ion actively transported from the cytoplasm of the parietal cell into the lumen.
Okay,
Okay.
ma'am. Okay, ma'am.
Then the water inside the cell dissociated to H plus and OH minus ions. Okay. This
Okay,
H
ma'am.
plus ions secreted into the canaliculi in exchange of potassium ions. H plus by H plus K plus ATPase. Okay.
Okay, ma'am.
So in addition to this, sodium ions are also reabsorbed from the lumen to the cell. Okay.
Okay, ma'am.
So the most of the potassium and sodium ions diffuse into the canaliculi, reabsorbed into the cell cytoplasm. Okay.
Okay, ma'am.
The hydrogen ion take their place in the canaliculi, giving a strong solution of hydrochloric acid in the canaliculi. Okay.
Okay. Okay.
Okay. This secretion, this hydrochloric acid, then secreted outward through the open end of the canaliculi into the lumen of the gland.
Okay, ma'am.
Okay.
Okay.
This is the mechanism of secretion of HCl. So water also passes into the canal by osmosis. That's the final secretion.
Okay.
HCl form. Okay.
Okay, ma'am. Okay.
The mechanism of secretion of HCl. Okay, is that clear? Any doubt, Vishnu?
No, should be fine. Yes, ma'am.
I will tell you once again.
Yes, ma'am.
So inside the cell,
Yes, ma'am. Yes, ma'am.
the carbon dioxide diffuses into the cell to form and combines with water to form carbonic acid and split into H plus and HCO3 minus ion. This HCO3 minus ion diffuse out of the cell and Cl minus enters into the cell in exchange of this bicarbonate ion, HCO3 minus ion.
Ma'am, what is that circle, ma'am?
Antiport mechanism.
Okay. Like, yes, ma'am.
Then the Cl minus ions diffuses, okay, into the lumen, means the canaliculi, okay.
Okay, ma'am.
So the negativity increases due to the entry of Cl minus ion.
Okay, ma'am.
So the potassium ions, in order to maintain this, the potassium ions and some sodium ions from the cytoplasm into the canaliculi flow. Okay, flows.
Ma'am, potassium ions flow to the plasma, no, ma'am?
No. To the lumen. Can you see this? No, not.
No, ma'am. Sodium ions go into the plasma, no, ma'am.
Later it will go. Later.
Oh,
Okay.
Okay, ma'am.
Okay.
Yes, ma'am.
Then what the water and water split into H plus and OH minus ions. Okay.
Okay.
This H plus ions secreted into the lumen in exchange of the potassium ions. We're using ATP, H plus K plus ATPase. Okay. So H plus and Cl minus ions are now in the lumen. You can see this in the diagram, H plus and the Cl minus ions. Okay.
And yes, ma'am, I can see. Yes, ma'am.
Then water also by osmosis, water also enter into the lumen by osmosis. Okay.
Okay, ma'am. Okay, ma'am.
Then in exchange of this, sodium ions, okay,
Yes, ma'am.
reabsorb, and potassium ions also reabsorb. Okay.
Okay.
Into the parietal cell.
Okay. Potassium ions get reabsorbed.
Yeah, reabsorbed. Once it is secreted
Okay,
into the
okay,
lumen, then again it reabsorb back into the cell. Reabsorption takes place.
okay, 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 ma'am.
Okay. This sodium ions diffuses out to the plasma. Okay. Then this sodium ions combines
Yes,
with
ma'am.
bicarbonate ion to form NaHCO3, sodium bicarbonate, formed in the extracellular fluid.
Sodium, ma'am, that's not there on the slide.
No, no, no. That's not in the slide. Only you have to study this
Okay,
mechanism
okay,
or secretion of HCl only. Okay.
okay, okay.
This is extra. Okay. So that's why after having lunch, bicarbonate secretion is more in our blood, because when the presence of HCl, this in sodium and this bicarbonate ion combines to form sodium bicarbonate. So the presence of bicarbonate ions becomes more after having lunch.
Okay, ma'am. Okay, okay.
This is the mechanism of secretion of HCl.
HCl. Yes, ma'am.
Okay, is that clear? Is that clear now?
Yes, ma'am. Yes, ma'am. So
If you
1
have
plus
any,
ATP and ADP, no, both place ADP is released
yeah,
after
yeah,
taking
yeah, yeah,
ATP.
yeah, 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 yeah.
So energy is required. That's why food
Yeah,
intake is
energy is
needed.
required.
For
Yeah, yeah, energy is required. Energy is
okay,
required.
okay,
Okay,
okay.
can we move to another topic?
Yes, ma'am.
Okay. Next, we are going to discuss about pancreas. This is also a very important topic.
Pancreas, yes, ma'am.
Yeah,
Pancreatic enzymes, yes, ma'am.
yeah, pancreatic enzymes and all. So in the pancreas also we have to study about the composition, function and regulation of the pancreatic juice. This is also an essay
Okay.
question. So salivary secretion is also an essay question. This gastric secretion also an essay question. Then pancreatic secretion essay question. Okay. Have you checked your previous year question papers, physiology?
No, I have it. I have to check. I took the question paper from the library yesterday.
Okay.
I have it with me.
Okay. Okay.
You want it? I can send it by blue team, ma'am. I have it with me, but
No, no need. I have previous year question paper. Okay. You
yes,
check.
ma'am.
You check. You
Thank
can
you.
see the questions there. This is important
Mm.
topic. Okay. So the pancreas.
Yes, ma'am.
Yeah. Pancreas lies parallel to and beneath the stomach. Okay.
Okay. Okay.
Parallel to and beneath the stomach. It's a compound gland. Okay.
Okay. Okay.
It means endocrine and exocrine secretions are there in pancreas.
Okay.
Endocrine cells and the exocrine cells. Exocrine means the secrete digestive enzyme, whereas endocrine means the secretion known as hormones.
Yes, ma'am.
Insulin, glucagon, etc. from the islets of
Mm.
Langerhans. Okay. This
Yes,
is the
ma'am.
endocrine secretion from the pancreas. In the digestive system, we have to study about the exocrine part of pancreas.
Yes, ma'am.
Okay, the exocrine part of pancreas. The exocrine part secrete enzymes.
Uh, yes, ma'am. Like trypsin and all. No?
Yeah, yeah. Yes.
Mm.
So the digestive enzyme secreted by the pancreas. These are secreted by the pancreatic SNA. Okay.
Okay.
So and also the ducts. Ducts are there, no? The ducts secrete bicarbonate ion. Okay.
Okay.
Actually, the main function is to digest all the 3 types of food. That means the carbohydrate, protein, lipid. The pancreatic cells secrete enzyme to digest all the 3 types of food.
Okay.
Okay. And also
Okay,
the
ma'am.
food, that means the chyme from the stomach enter into the intestine, which is rich of HCl.
Okay.
HCl. So in order to neutralize the acid, the ducts secrete bicarbonate. Okay, the HCl is highly potent, so it may digest the intestine. So to neutralize this acid, the pancreatic cells, means the duct cells, secrete bicarbonate and water. Okay, the cell ducts secrete bicarbonate and water to neutralize the acid, and also to digest the food. The pancreatic cells secrete enzymes. Is that clear?
Yes, ma'am.
Okay. The pancreatic juice, it is alkaline and has the high digesting power, and 1 to 1.5 liter of pancreatic juice secreted per day. And the pH is 8 to 8.3. It is watery. Okay. Alkaline
what,
is
ma'am?
high. What?
It is what, ma'am? I didn't hear that.
Watery, watery, water rich.
Okay, watery.
Water rich. Okay. Can you see the screen?
Water rich.
Water rich. Can you see the screen?
Yeah, ma'am, I can say pancreas is parallel and beneath. The stomach is a large compound with most of its internal structure.
I have changed the slide. Can you see now?
I'll come.
Yeah.
You said, ma'am, that by the time.
Yeah. Diagram. The diagram of pancreas.
This is a diagram.
You know, okay. Oh my God. Okay, I will teach you. Okay. Next, we are going to discuss about the composition of pancreatic juice. Okay.
Okay, ma'am.
So, it contains 99.95% of water. 99.5% came.
Pancreas. First, one diagram came. Now it's in composition.
Yeah. Can you see the diagram? Can you see the
If you go
diagram now?
one slide back, I can see, ma'am.
Yeah.
When you went, yeah,
Yeah.
I came.
Yeah, I went.
Pancreatic juice.
Okay. Can you see the diagram?
Yes, ma'am.
Yeah, the duct cells and the pancreatic acini. Okay. In the second diagram, the ducts, the branches, you can see the branches. These ducts secrete water and bicarbonate, whereas the cells, okay, the cells secrete the enzymes. Okay. Okay. Then the composition of, can you see the next slide? Composition of pancreatic juice.
Yes, ma'am.
Okay. It's 99.5% of water, then 0.5% of solid. Okay.
Solids.
Yeah, the solid part again divided to organic and the inorganic part. The organic part contains the enzymes. So the secretion is rich in enzyme. So yeah, all the three, it can digest all the three types of food. So the protein digesting enzyme, lipid digesting enzyme, and the carbohydrate digesting enzymes are present in the pancreatic secretion. Okay. So the protein digesting enzymes are the trypsin, chymotrypsin, carboxypeptidase, nuclease. Vishnu, can you hear me, Vishnu?
Yes, ma'am. It's
Is it breaking? Is it
it is actually
breaking?
It is breaking, but I heard nucleus.
Okay.
Hello, ma'am.
Yeah.
Can you hear me?
Yeah, I can hear you.
Yes. It is breaking, but I can hear now.
Okay. Trypsin, chymotrypsin, carboxypeptidase, nuclease, elastase, and the collagenase. These are the protein digesting enzymes. Okay.
Okay, ma'am.
Then the carbohydrate digesting enzyme is the pancreatic amylase. Carbohydrate digesting enzyme. Okay.
ma'am.
Then the lipid digesting enzyme. So the pancreatic lipase, cholesterol ester hydrolase, Phospholipase A, phospholipase B, colipase, etc. These are the lipid digesting enzyme.